Hey, Joe Zarzaur here with Dr. Malone for another installment of Zarzaur Law TV. As you may or may not know, Evan he finished his 20th IRONMAN triathlon this month.
Yeah, a couple weeks ago.
I finished my third. We did it in Cozumel, and since we spent the last 8 months training for this race, which involves 12 hours, 13 hours, depending on how well trained you are, of cardio.
How disciplined you are.
That too. The idea of cardio respiratory fitness was at the top of our minds, and it just so happens that the Journal of American Medical, is it Journal? JAMA, not to be confused with BAMA, JAMA. JAMA, which is the Journal of, what is it called?
Journal of Medical Association.
Thank you. Which pretty much most everybody has heard of, came out with a study which involved a fair number of people too. It was like over 100,000, right?
Over 100, 122,000.
That's a good sample size. And they basically concluded that exercise is good for you. Shocker, right? Dr. Malone is here to discuss with you guys exactly what this article says and exactly what it means to your everyday life, in hopes that we can maybe give you a tidbit of advice. So what do you think, Doc?
Well, and as Joe said in the lead-in here, it lined up right around the time we were getting ready to go to Ironman, and I sent Joe an infographic that I had seen where, and this is related to the study, where it says that sitting for 8 hours, sedentary at an office, usually like an office chair or something like that, is the equivalent of having any other risk factor for cardiovascular disease.
Smoking.
Obesity.
Morbidly obese.
It's like another strike. So if you smoke and you're sedentary,
It's 2 strikes.
yeah, exactly. So the idea is, how can we offset this? So there was a meta-analysis done, looked at over 1 million.
Meta-analysis meaning?
It looks at tons of studies and compiles all the data.
Okay.
And all the data ended up being more than 1 million individual samples or people. And they concluded that you can offset that 8 hours of being sedentary by being active for 60 to 75 minutes per day. And it doesn't mean you have to go do
That sounds like a lot.
Yeah, it doesn't mean you have to do a triathlon every day for an hour.
I know an hour a day
Yeah,
is a lot.
but
for
it
most
doesn't
people.
need to be in one session.
Okay.
So it means go walk for a half an hour during your lunch break, do a yoga session after work, walk your dog after work, go for a walk with your spouse or significant other after work, or something like that, where you're getting your heart rate up. So it doesn't mean pouring sweat.
Okay.
It's challenging yourself, getting your heart rate up. You'll feel it where you're huffing and puffing a little bit. Doing that for 60 to 75 minutes can offset the 8 hours of being sedentary, which if you do have another strike against you, one that you cannot modify, you have diabetes, you are overweight, you have family history, let's get rid of the additional strike for cardiovascular disease.
You can cancel one out by just being a little more active.
Yeah, and so it's every day. And on the days that you're not working, so let's say you work 5 days a week, you have 2 days that it doesn't mean do all 7 hours in one day. It has to be consistent.
So what were some of the examples of the exercise in the study that people were doing? What kind of?
It's basically just being active. So like I said, so they looked at taking your lunch break and doing something besides taking another hour of sitting and eating.
Okay.
So yeah, eat something healthy and light, and then go for a walk, go for a swim, go get on a stationary bike or a trainer or a treadmill or something like that. So
And so, just to make sure, the study was saying that 8 hours of sitting is bad for you. What if, some people have these stand-up desks where they're not moving much, but they're standing up.
Yeah.
Is that still apply?
I don't think that was included in this. So this looked at more of the sedentary, and it wasn't necessarily people just working. It could be people sitting on a couch at home.
Okay.
So it just looked at sedentary or lack of activity for 8 hours in a block period of time over the course of a day.
All right.
On a routine basis.
So, two Ironman triathletes trying to tell you to do exercise.
Well, so then what parlayed into the next thing was we had this cardiovascular fitness study that came out, which is the one you referred to as 120,000 subjects that was published in JAMA just this month. It's the first of its kind, and it looked over 14 years at these subjects. Mean age was about 52, 53 years of age, and it was all comers who were getting cardiovascular fitness testing for whatever the reason may be. The cardiologist sent them there because they had chest pain. Their doctor sent them there because they had some shortness of breath, whatever. And it concluded that there is no upper limit to cardiovascular fitness in benefiting you in all-causes mortality, meaning all these stories you hear about, oh, of course he fell over dead, he was running. It doesn't apply. Okay?
Unless you have some congenital abnormality or structural abnormality.
Say for congenital abnormalities or other comorbid illness that you didn't know about, like if you are a dialysis patient and you decide that you want to go run a marathon, probably not a good idea.
Right.
But for these individuals who are being referred for stress testing, that the more fit they were, the better they did on that test, the longer they lived. Okay. And they sampled that over 14 years.
Another shocker.
Yeah, but it's important because this is the first study where it's going to open the door to a lot of other studies where how can we control more variables and get more data and learn about this.
Right.
So
from a personal injury standpoint, there's not a lot for me to chime in with that, but I will say that we're not all about just spouting off things that help the bottom line here. We're really interested, at least we talk about being interested, in your overall health and well-being. And heck, I have this discussion with my clients too, but I mean, a lot of them are hurt, they don't feel like moving, and the last thing I tell them to do is sit on the couch. I'm like, look, I've got people that are in wheelchairs that are trying their best to do exercise. I've got clients that don't have legs that are trying to exercise. So it doesn't just apply to healthy, able-bodied people who don't have injuries.
Yeah.
It can apply to people that have even more things stacked against them in their ability to move.
Yeah, so if you have an injury or you have some other condition that's being managed by a physician, talk with that physician and say, what can I do? What's appropriate for me? What can we tailor for me? So fitness isn't applicable to just someone who's some elite marathon runner. It can be relative to the patient. So you can have one leg and still do really well on getting your metabolic equivalents up when you're exercising.
Right.
You can have any other condition and your metabolic equivalent, you don't look like the elite marathoner, but you can get those metabolic equivalents up when you're on the treadmill. If you can do that on a routine basis, you'll benefit in the long term.
Okay, great. We're going to put a link to the article on this down here on this video, and we're also going to have the infographic thing either linked or actually displaying down here below, or maybe up above us or off to the side, somewhere in the margins. But thanks for joining us. You can find us on the web at zarzaurlaw.com, 855-HIRE-JOE on the old-fashioned phone. Thank you.